Hi, this is Chris Costello, and I've teamed up with Michael Senoff to bring you the world's best wellness-related interviews. So if you know anyone struggling with their weight, with cancer, diabetes, ADHD, autism, heart disease, or other health challenges, please send them to Michael Senoff's hardtofindseminars.com. What is the thyroid and what does it do?
The thyroid is a very small gland. It's located in the neck, behind and below about where the Adam's apple would be located. It's shaped like a butterfly, and it weighs no more than an ounce, but it is the master gland of metabolism and energy. And it produces the hormones that go to every cell, tissue, gland, and organ in the body, delivering oxygen and energy. So in a lot of ways, it could be thought of as the gasoline that runs the car in our body, but essentially it's controlling all the aspects of our energy and metabolism.
There's an awful lot of talk about thyroid conditions lately. Now, what is going on? Have things changed in our society that we're having these conditions more frequently? What do you think is happening?
Well, we know that they're on the rise. There seems to be an increase in thyroid disease in general. Patients are also starting to become more aware and asking more questions, learning more, and doctors are becoming a little bit more tuned in to the fact that we have a vast number of people out there with thyroid problems, and the majority of them are not being diagnosed and not treated.
So you wrote the Menopause Thyroid Solution, and, what can you tell women about some of the symptoms that they can look for?
The Menopause Thyroid Solution's purpose, what I was going for in terms of writing this book, is to really help the 40 million women out there between the ages of 40 to 60. And these women are very often trying to live and feel well, but they're running into a variety of symptoms, everything from hair loss, erratic periods, loss of sex drive, depression, weight gain, all sorts of symptoms. When they're younger, in their 40s, they may say, well, okay, it might be stress, depression, PMS. As they get into their 50s, the assumption is oftentimes, well, it must be my menopause kicking in. But the reality is that for a substantial number of these women that are experiencing these symptoms, the problem's not menopause, the problem's not PMS, the problem is what I'm calling a thyropause. It's a slowdown in the thyroid function that happens in many women as we hit the 40 and beyond age range. So a lot of women who are struggling with all sorts of symptoms and either treating them with hormones or suffering through them without any support could actually be properly diagnosed and treated and actually even sail through their menopause feeling and living well if they got their thyroid checked and properly treated.
And how do they go about getting them checked and properly treated? Because I know in the book you mentioned things about sometimes it's hard to get a diagnosis.
Well, it can be a bit of a challenge, and one of the things that I always urge women to realize is that when you go for your annual physical, you're not getting your thyroid checked for the most part. A lot of people will say, well, no, my thyroid must be fine. I went and had my physical, had my cholesterol level, and nobody told me I had a thyroid problem. And the problem is that our annual physicals and the blood work that we typically have done to check cholesterol levels and such very rarely includes thyroid unless we specifically ask for it or unless our doctor has specifically said, I'm going to check your thyroid on your annual blood work. So women really need to go into their doctors armed with information and ready to ask for a complete thyroid evaluation, and that includes a TSH test, which is a thyroid-stimulating hormone test, a free T4 test, free T3. Those are measurements of the actual circulating levels of thyroid hormone. We also want the thyroid antibodies to be evaluated because that tells us whether we've got autoimmune thyroid disease that's brewing in the system. And we also want to have the doctor do a hands-on comprehensive examination clinically for thyroid disease. So that involves the doctor putting his or her hands on your neck, checking for lumps, checking for enlargement, looking at your reflexes, examining you for puffiness and swelling, checking for hair loss, looking at the outer edges of your eyebrows. That's actually a very common sign of thyroid problems in women is loss of the outer edge of the eyebrows. So we want that doctor to not only do the blood work, but to use his or her medical evaluation skill to take a good look and really look for evidence and signs of thyroid disease.
What are some of the symptoms that a lot of women will start feeling? And most women, what ages do they start feeling these symptoms?
Well, the symptoms can range from fatigue, weight gain, or difficulty losing weight despite diet and exercise, high cholesterol, including cholesterol that won't respond to medication, depression, especially depression that's not necessarily relieved by an antidepressant, infertility, erratic periods, loss of sex drive, hair loss, that loss of the outer edge of the eyebrows, as I mentioned. Skin can get dry in some cases. Some people will have a low resistance to infection, constipation, feeling very cold all the time, even when it's warm out, and sleep disturbances. Some women, they actually will have temperature changes, hot and cold, so they may feel almost like they're having hot flashes. So there's a lot of different symptoms that are associated with thyroid. And thyroid disease can affect women at any age. I mean, we have women developing problems in their teens, in their 20s, but they're most common during periods of hormonal change. So during pregnancy, the period right after pregnancy, postpartum, and also the period when we start perimenopause, the early 40s, when hormones start to change even though we're still having menstrual periods, into menopause, the point at which the periods have stopped. These are times when thyroid disease is much more common. There's a lot of misdiagnosis. So we just heard recently from some statistics in a journal study that 27 million Americans are on antidepressant drugs right now. And while they haven't been able to study the specifics, I am guaranteeing you that a percentage of that 27 million are people with thyroid problems who've never been properly tested or diagnosed. And we also have a lot of women struggling with infertility who are going for very expensive infertility treatments, assisted reproduction treatments, $10,000 a month in vitro fertilization cycles. And there are some fertility clinics in the United States where thyroid testing is not even part of the normal workup for a woman's infertility. So we're seeing all sorts of real travesties like that. But the bottom line is a lot of women, they're walking into their doctor, they don't feel well, they say they're depressed, they're stressed out, they're tired, they're gaining some weight, and they are walking out, as you said, either with antidepressants, or they're walking out with hormone replacement therapy or diet drugs, or, in some cases, they're not even getting any help at all, and the doctors are saying, well, what do you expect? This is how it is after you've had a baby, or when you're busy, or when you're 50, or when you're 60, and, they're basically told that this is how they're supposed to feel at the age that they're at. Certainly, women definitely are going to want to ask for the TSH test, which is considered the standard conventional test to diagnose thyroid disease. But they also need to be aware that what the lab considers to be a normal range and what some of the most conventional doctors consider to be normal is actually much higher than what a lot of the more innovative and hormone-oriented practitioners understand to be normal. So if you get a TSH test or your doctor calls and says, oh, we tested your thyroid, it's normal, that's not enough information. You need to know what that TSH number was and what the doctor is using as a normal range, because most people with levels above 3 and up to like 5 and 6 will be told that they're normal by many doctors when those levels are actually, according to some of the latest research, considered to be hypothyroid and warranting treatment in some patients. Also, the free T4 and free T3, these are measurements of the actual thyroid hormone, are going to give us a better picture of what's actually going on at the blood level in terms of these hormones. So sometimes people can have a normal TSH, but if their free T4 and free T3 indicate that they are deficient in hormone, they may benefit from some treatment. And then there's a category of people who have very elevated antibodies, which are indicative of the onset of an autoimmune disease, meaning that the body has decided to attack its own organs or glands, in this case the thyroid, who may have normal TSH and normal circulating hormones, but if they have very elevated antibodies, that tells us that their thyroid is on its way to failure.
Hi, it's Michael Senoff with HardToFindSeminars.com. Thanks for watching this video. Many of my interviews last 30 minutes, 40 minutes, an hour, sometimes even up to 2.5 hours long. They're actual mini seminars, and you've just listened to a short sample of just one of over 117 hours of exciting, hard-hitting, mind-blowing interviews on how to make money in direct mail, advertising, copywriting. I assure you, there is not a resource anywhere on the internet or on the planet that comes close to the free information I provide at HardToFindSeminars.com. So go right now to HardToFindSeminars.com and you'll have free access to 117 hours of audio interviews with typed word-for-word downloadable transcripts and downloadable MP3 files. Please browse some more of the videos or go right directly to HardToFindSeminars.com. Thanks for watching.